Hello colleagues. Today in this Epicon, COPD Compass 2025 is going to be released. Under the able mentorship as well as the leadership of the API, this book, which was developed last year, COPD Compass in 2024, highlighted every question which you have in your mind when you are looking at the patients of COPD, whether it is related to diagnosis or it is related to their management or about their future and prognosis. It was discussed last year in Delhi that what about the updates? So today COPD Compass 2025 will have these updates, and these updates will definitely help us to keep ourselves abreast with the knowledge of what is latest in COPD. We all know COPD is the second leading cause of death worldwide. But in India, in some of the states like Uttar Pradesh, from where I come from, it is the number one killer. How can we improve the lives of the patients? By keeping ourselves with the latest knowledge and use it in our daily practice. So there are key highlights which have been added in 2025 COPD Compass and in the same question answer form. We have some updated definitions where structural and physiological as well as vascular abnormalities picked up on the various tests are also being documented in COPD, like emphysema picked up on CT scan. There are broader risk factors, a lot of the new ones, and there is a chapter on climate as well as the effect of pollution. Very importantly, and for the physicians, is the role of spirometry. Previously, COPD has been always diagnosed with post-bronchodilator FEV1 of less than 0.7, equal to or less than 0.7. However, this edition of COPD, which has been taken up from Gold Update, actually goes away with the post-bronchodilator test if FEV1 over FVC ratio is more than 0.7, which practically excludes COPD. This will make a life more easier for the physicians because they can quickly screen their patients by doing pre-bronchodilator spirometry. Then we come to what is the other things which are going on in these updates. So when we look at these updates, there are certain updates which are related to comorbidities, which is very important again from the physician's perspective because they see a lot of them. And the most important highlighted is cardiovascular comorbidity. Patient who gets admitted with acute exacerbation of COPD runs 20 times higher risk of developing acute coronary event, and most frequently within 5 days of admission, maximally within 1 month even after discharge. But this increased prevalence of coronary events after a single episode of acute exacerbation of COPD does not become normal even at 1 year. It continues to run the high risk. So how important it is to look into picking up the coronary related or heart related comorbidity in patients with COPD is very much emphasized, and even simple biomarkers like anti-proBNP as well as troponins have been recommended during the acute exacerbations so that we don't miss the diagnosis of cardiac comorbidity. Very importantly, pulmonary hypertension has been brought in, and that needs to be screened by echo, and then of course we need to see whether it is severe or mild to moderate, and only the severe one needs the treatment, and that too after a thorough evaluation for other causes of pulmonary hypertension and perhaps a right heart catheterization. In the management of COPD, 2 new drugs have been added. One for those patients who continues to be breathless despite being on dual bronchodilator, that is nebulized ensifentrine. Maybe soon we'll get it in India too. And the second one in those patients who continue to exacerbate despite on triple therapy, and that is dupilumab, which is a monoclonal antibody. Along with emphasis on pulmonary rehabilitation and taking care of the environment and things which are making the COPD worse, all needs to be looked into. So let's use this COPD Compass 2025 with recent updates included in it and utilize it in our practice to improve the overall healthcare which is being provided to patients of COPD. Kudos to API for bringing us this excellent document, and it should be on the table of each one of you. It is on my table even. Even I need to go back and read many a times. And I'm sure you will also enjoy reading it because it is in unique question answer form. So do read in, and if you have any suggestions, pass on to your API representatives, because definitely in 26 again, there will be an update. With that, I will say that it's best of luck to the organizers, our API team, and of course, the 20,000 physicians all across India who are going to be benefited by this COPD Compass 2025. Thank you very much, and thank you API.